Alors, chers collègues, bienvenue à
Dear colleagues, welcome to this press conference to talk about the Quebec situation about COVID-19. The Premier of Quebec, Mr. François Legault, is, as usual, together with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health, Dr. Horatio Arruda. Mr. Premier. Hello. Thank you. I'm going to start with the day's numbers. We have today 29 new deaths for a total of 150. So, of course, this is something that we're not getting used to. I want to offer my sincere condolences to the families of all these people. We now have 9,340 confirmed cases, an increase of 760. We have 593 people who are being hospitalized, an increase of 50. And we have 164 people in ICU, so no increase, or at least no net increase. That is the day's good news because, as you know, and you will see it in the projections that will be presented a little later by the experts, that this is what we're keeping an eye on the most, the number of people in intensive care. So despite the deaths, and this is something that we do not get used to, new deaths, it remains that if we look at the situation coldly, hospitalizations and ICU numbers, the increase is stabilizing. So that's encouraging that we are soon reaching that peak. But despite the fact that it is encouraging, the battle has not been won. So if we want to progressively be able to go back to a normal life in May, it is important to remain very disciplined during the entire month of April. Where it's more difficult as well, and I believe that it has to be said to Quebecers, is all the situations in the CHSLDs and residences for the elderly. I have asked that staff be added. So nurses, doctors, we have the opportunity of having fewer people as expected in our hospitals. Therefore, we'll be able to take some of that staff, which is people who are in hospital right now, nurses and doctors, and put them in CHSLDs and in elderly homes, because there's a lot of cases in those places. And of course, it remains the great priority of our government, that of protecting those people who are the most vulnerable to this virus, so the people aged 70 and over. As far as the PPEs are concerned, the situation is stable, so about the same as yesterday. However, I'd like to add, there is a concern being added, and that is the material to do the screening test, what we call the reagent. To be able to analyze a test, we need reagents, and right now we have enough for 6 or 7 days' worth. And we're working very hard. I know that there's a formula that was sent to Winnipeg, and we're supposed to get the formula to be able to make it ourselves, but it's being delayed, and we only have 6 or 7 days of material left to be able to continue testing. A word on the predictions that are going to be presented to you and explained to you by experts a little later, I think at 3:30. You'll be seeing that there are scenarios. There's one that is more pessimistic, one that is more optimistic. I wouldn't want to alarm anybody with the pessimistic scenario. You'll be seeing that, of course, when we look at the number of predicted deaths, it can be concerning and worrying. And of course, these scenarios were made using the experience that was experienced in the past few weeks in European countries, because the coronavirus started spreading in those countries before ours. So we're basing ourselves on those projections to project or predict things in Quebec. So of course there were countries where it was very hard, such as Italy and Spain. So of course if we use those scenarios to make projections in Quebec, it may give scenarios where there's a lot of deaths. But it remains that up until now, we're much closer to those scenarios of the countries where things went for the better. And right now, we're heading the right way. We have way fewer deaths than the European average, keeping proportions in mind. But that doesn't mean that we have to slacken our efforts. Let's not forget that if we change it, we could ruin all the efforts that we've deployed over the last few weeks. So it's important to respect the guidelines. It's also important to not have gatherings. And now I want to speak to all Quebecers on, we all know it's Easter weekend, and it's part of the traditions in Quebec to go to church or to have family dinners. The Jewish community goes to synagogues. It's really important that there not be physical gatherings. This is not the time to have a family party over the weekend. You can do it through video conferencing, through the phone, but not physically. It's important this year. And I am counting on the leaders of all the religious communities, amongst others, to pass that message. There cannot be any physical gatherings for any religious observation. So it's important that these be followed. I would like now to speak to you a little, because there seems to be a slight controversy, which isn't really one, but on the wearing of masks by citizens. As Dr. Arruda was explaining, yes, it could help adding a mask for citizens to avoid spreading the virus. So first, there are three important things that have to be understood well. First, when you wear a mask, it's not to protect yourself, it's to protect others. Secondly, when we see that the stockpiles of masks are tight at hospitals, well, don't take N95 masks or surgical masks for citizens. Those masks should be left to the medical and healthcare staff. You can make other kinds of masks, and perhaps there are people who will be proposing different masks, but the masks that are used in hospital settings have to be left in hospital settings. And what is perhaps the most important, and what Dr. Arruda is continuously repeating, is that masks can in no way whatsoever replace the other guidelines. This is something that can be added to the other guidelines. But remaining far from other people is a great deal more efficient if you don't want to contaminate them rather than wearing a mask. So it's important to continue respecting the guidelines. And of course, in these recommendations, Dr. Arruda takes into account our culture. It is not in the Quebec culture to wear masks. It exists in other countries. I remember having gone to Japan 15 or 20 years ago, and people there, when they have a cold, when they have a flu, to respect others, they wear a mask, and that is part of their culture. But for us, it might look strange to start seeing a lot of people walking around with masks on. So we're taking that into account as well, to say, well, concentrate on keeping a 2-meter distance between yourselves and others, washing your hands, and particularly if you have the virus or you think that you might perhaps have caught it, well, stay home. That is the best way to not contaminate anybody else. Now, my daily thanks. Today, I wish to thank the 125 members of Parliament of the National Assembly with the writing staff. You cannot imagine, and now I'm talking to many people, but you cannot imagine the number of citizens that go into those offices, that call writing offices to ask questions. Is this program applicable to me? What organization could help me? There are organizations, and call them as well, and saying, well, I don't have enough volunteers. Can you find volunteers for me? It's incredible, the work that is being done by all 25 MPPs of all parties. And we also use the MPPs in order to spread the information and get the information from the field, from the base, and then bring it back up. So I speak with all leaders of the opposition, every few days, and they get to me with all sorts of suggestions, and we correct and adjust what the government is doing using that information that the 125 MPPs, all the information they give to us. So I want to say bravo to all those MPPs and all of their staff in the writing offices. Thank you for all the work that you've been doing. It's really appreciated by all citizens. And I end with our 3 priorities. Don't leave home for the month of April unless it is absolutely necessary. If you do go out, remain 2 meters away from anybody else, and when you come home, you wash your hands with soap. Perhaps before going any further, I wanted to show you a little video that I got this morning in my county office by a little girl, 7 years old, who's called Raphael. Mr. Legault, even though we're in confinement, could we still... she wants to know whether the tooth fairy is still traveling around despite confinement. So I want to tell Raphael and all children that I made sure that the tooth fairy will now be on the list of essential services. So that will continue. And I want to also reassure all parents, the tooth fairy has immunity against the coronavirus. So there is no danger. The tooth fairy will continue doing her excellent work. Raphael, thank you for your question. So everyone is now reassured. Did you want to say a few words in English?
Good afternoon. Our ultimate goal is to limit the number of deaths to save lives. Our intensive care statistics show us that we're going in the right direction. We're making progress in our battle against the virus, and the projections that our experts will reveal this afternoon will show that. But I want to be very clear. This doesn't mean we can ease our efforts. We cannot spoil all that we've accomplished together in the last few weeks. There must be no gatherings, including for religious celebrations such as Easter. It's more important than ever to stay focused on our 3 priorities. Don't go out unless it's necessary. If you do go out, keep your distances. And when you come back home, wash your hands. And for the children asking, I can confirm that the tooth fairy now is on the list of essential service and is immune to the coronavirus. Thank you all.
Merci, Monsieur le Premier ministre. Alors pour la
Thank you, Mr. Premier. For the question period, we will start today with Marie-Michel Sioui of the Devoir. Hello to all 3 of you. On Sunday, Mr. Massé declared that 60% of total deaths had taken place either in CHSLDs or private residences for the elderly. You once again sent a message about this, Mr. Legault. What explains that we have not succeeded protecting the people who live in those resources? And the crack. How come we didn't find the crack? Has the virus arrived because of people who work there or residences that didn't respect the guidelines? Where did we fail? Well, it's a series of reasons, amongst them the ones that you mentioned. Of course, habits in certain CHSLDs, whether they be private or public, in certain residences, is to have a lot of staff that went to many different residences, and a lot of part-timers, and sometimes as well, not enough staff, and that is why we added resources. Of course, adding money doesn't fix every problem. There are positions that are posted that are not filled, and that is why today we're taking great means to say we're going to take staff that right now is working in a hospital setting, so doctors and nurses, and we're going to be sending them to residences. First, to make sure that we have all necessary staff, and to make sure that there's less rotation of staff, and that all the standards and guidelines be respected, you know, that we separate, for example, the hot zones from the cold zones, and that people coming in and out be controlled more than ever, all emergency exits, for example, so that we avoid that people come in and out of those residences. So I don't think that it is something that is unique to Quebec. We see the same kind of problem pretty much all over the place in other states. It's somewhat normal that these people be more vulnerable. They are more numerous, of course, than people in a house. So there's a greater risk of contagion. But I can tell you that we took great means to do everything to protect the elderly. And it's important to say so. There's perhaps 700 residences that perhaps have contamination, but there's only about 150 where it's been confirmed. The others is that we take it for granted that there might be a problem. So we are seeing to the cases correctly, ensuring that there's good management in each of those facilities, and to make sure that if they don't find the staff, even if it's necessary to send people who don't have all the qualifications, well, that is still better than not having enough staff. So there is work. We knew that even before the coronavirus crisis, there already was a problem of staffing in CHSLDs and certain private residences. So you have seen that we have increased the wages of the attendants by $4 an hour. So we are making efforts. It's still not enough. We had to make more efforts because that is where our priority must be. I just spoke with the CEOs of all Quebec establishments and facilities about an hour ago, and this is a great priority. We're going to send reinforcements. We're already doing it. We're sending reinforcements. We also wish there to be nurses in infection preventions on the premises, because we have to organize these places securely, and that is what we've just done as well. So what I can tell you is that everybody is working hard as of now. It's already started in order to continue reinforcing all of our interventions in those facilities and organize them safely. And I'm launching the call. If there are nurses that are retired and who used to work in infection prevention and you want to come help us, come help us. We need you. The other thing that I wish to say as well is that family doctors. I spoke to the president of the FMOQ yesterday, and he said to me that family doctors are ready, really, to come help CHSLDs. So there are a lot of people that are raising their hand up high, and we really are going to be bringing that necessary reinforcements to the CHSLDs. And let's not forget also the private residences and RPAs, that is the resources for, or residences for the elderly people, and intermediary resources, and private CHSLDs. Ms. Bleu announced $133 million. So we're helping, and we are helping them to find staff. We have to add staff. We are linked together, and we're going to reinforce our actions to support our partners. Mr. Legault, you're not going to be at the technical briefing. Why? Well, I think that it's important that the population sees that this is a scenario that is not political. This is a scenario that is going to be presented by scientists, by experts, in all transparency. So it's the experts that are going to be presenting the scenario and who are going to be answering your questions.
Bonjour.
I'd like to come back to the CHSLDs. Would it be possible, Dr. Ruda, to have a specific portrait? I mean, it's always very sad to talk about deaths, and now we have 150. Is it mainly people who were in residences for the elderly, CHSLDs? And can we have an idea of the age breakdown? Is it people 80 and over? It's pretty difficult to get numbers and to be able to have an idea. Please. Yes, I'm going to tell you. So we're talking about deaths, right? I'm not talking about cases. I'm talking about the deaths here. 26.7% come from homes, so people who are at their own homes. 44.7% who come from CHSLDs. 20% that come from residences for the elderly, and 13% that is unknown because the investigation was still ongoing. So we haven't finished that work yet. So we can see that most people right now were from CHSLDs and at home, and the what we call RPAs, the residences for the elderly, which was higher at the beginning, went down to 20%. Now, for the age breakdown, it still is truly, I would say, 98% of people are above 70 years of age. Just to give you an example of the number, 84, 70 and over, 13 people 90 and over. The 50 to 59 age group, there were 2 people and 1 person, as you know, we've talked about it already, between 30 and 39 years of age. So this, once again, is a profile that is unfortunately, well, it doesn't mean that other people don't get ill. If you look, the young people, do fall ill, but they don't get these complications. That's where we're deploying so much energy, where these people live. So, a place where people live, it's not, completely airtight. There was the effect of traveling at the beginning that went through, family members that came back from traveling and went to visit, but also people who left. It's a mixture of factors, and it's pretty rare that it's totally airtight. Every season we have flus in these centers because there's a lot of movement in the communities, and also, gastrointestinal problems. So that is why we are being really restrictive now in order to avoid these things, and the reorganization of the staff to avoid that people from one center will go to another, because it even, spread cases of gastro-related diseases every year. Well, it's going to put an end to that. We see that the problem really is in the CHSLDs. In Navarre, there's 105 residents that tested positive and that are having problem in one residence, where there were many deaths in that same residence. Did we underestimate the entry of the virus in those residences? Did we not act quickly enough 2 weeks ago? Well, listen, what we underestimated, we've always said that we were worried for this specific clientele. The protocols have been set up. The problem, I believe, which is an important factor, and I want to say very honest, we'll also be looking at it in hindsight, each of the elements. But the fact that certain people are asymptomatic or have very few symptoms made it that certain healthcare workers who had perhaps been infected, for example, were able to go in, or somebody from a family member. So I think that's very important. And that notion of being asymptomatic, it's relatively recent. We didn't necessarily used to talk about that at the beginning of February, so there is a possibility. And we don't know to what extent either, what we call the generator of maximum cases, because we think that when you are asymptomatic, you contaminate more people. But it really is that people who had no symptoms or very few symptoms, and there might also be, and these are hypotheses, but healthcare workers who thought that it was like a cold and that it was, nothing to worry about, and they didn't want to, since there's not enough staff, they went to work anyway. And I think that this is going to be looked at. But what has to be understood is that this phenomena is not unique to Quebec, it's everywhere. The protocols are there. The orientations were given. To what extent were they applied? That's another issue, and it's true that in residences for the elderly, there aren't nurses in every single one, and there aren't always nurses who are there in prevention and control of infections. And so when that enters in those living spaces, taking into account the high susceptibility and the kind of care that is given to people in the proximity, well, it spreads. It's like a gastrointestinal epidemic as well. We have that every year, and the flu as well. So I think that your question is pertinent. We will be looking at it to better understand, and I do believe that, like every time, maybe we'll change the way that we think about residences for the elderly. Maybe we'll change the ratio of professionals to individuals. We'll see. And I would tell you, Mr. Laforêt, that I don't have the impression that we underestimated the situation in the residences for the elderly or CHSLDs. As of the first meetings, we right away said that is what the priority is. We were amongst the first to ban visits. We were amongst the first to add resources. And it has to be understood as well that the people who are in CHSLDs are already ill, so they are more vulnerable than other people of the same age bracket who are at home. So that also has to be understood, that we were expecting to have a relatively high number of deaths in those residences. Where we overestimated the problem is in hospitals, because right now we have way fewer people who are hospitalized in ICU than we thought we would. So we're taking that staff and sending them to residences for the elderly, and I think that we're doing the right things at the right moment. And I would like to add, Mr. Premier, that I have the opportunity of speaking with my colleagues throughout Canada, the other health ministers of other provinces, and it's the same thing everywhere. That is the present challenge, and it has been even since the beginning. So, of course, we have to take every measure that we took since the beginning, and we are moving staff from the hospital settings to CHSLDs right now. Paris has decided to ban jogging as of tomorrow from 10 in the morning to 7 p.m. Does Quebec Public Health recommend the same thing for big cities, including Montreal, perhaps even Quebec City? Well, I can't dare to say what we'll say tomorrow or the day after, because we never know. But one of the principles that we mention is social distancing. If people jog 3 or 4 meters away from other people and they don't gather and they're out in the air outside, I think that it can be adequate. In the restriction of things, in my opinion, you have to restrain things that contribute to the disease. Restraining gatherings. It's not time to, make a pineapple ham for Easter and invite your in-laws, even if you think that they're reliable. If somebody needs to run and usually runs, if you take that running away from them and they run in a perspective where, they're not gathering with other people elsewhere, they're not, closing somebody following, they do it at a time that there's not too many people. You know what I mean? I think that at some point we have to be able to have these ways of spending ourselves. Other people are going to go crazy if we don't have that valve to remove some of the pressure. If we need to get to that, we'll see, but I don't think that we're there. And it's the same thing when the Premier talks about not necessarily, using masks or not, but what we have to do is avoid gatherings. If a couple lives together in the same home and they're walking together, you have to keep social distance. I even saw in a video, I don't know if you saw it on television, somebody who around them who was running, like jogging, and they had put 2 meters of wires all around them, suspended around themselves. When he runs, nobody can get close to him. Well, it's ingenious, but that's the principle. It showed what the distance is that we are supposed to maintain around ourselves in order to not get contaminated. And I think that as long as that principle is being followed, and we don't gather, and we're not ill either, because if ever you are ill and you want to, run tomorrow to go to the hospital, well, use a mask to protect others. But I think that that's where we're at now. Why they banned jogging in France, I don't know. Is it a question of density? Did people gather? I can't tell you. But right now, what we've already said, however, to avoid running in neighborhoods where there is contamination. Don't go too far from your home. It can be one thing. But at the same time, if you don't meet anybody, the virus is not up in the air in the cities and in the environment. So I think that that's what my explanation is. And if you respect that as a principle, you'll be okay. People who had homes built and they're supposed to have new condos and then they have to leave because other people are taking over their apartment, what are we going to do? Well, for now, we wish there not to be any moves, anybody moving in the month of April. We will reopen construction as soon as it's possible to do so. So, for the time being, we're prudent, but we're very conscious of that problem, that there's going to be a domino effect on people who won't have their homes on time.
Bonjour, Monsieur Legault, Madame McCann, Monsieur Arruda. Justement, ma question pour...
My question was on construction in particular. You talked about the fact that once the curve would start going back down and that we would slacken a little bit the confinement measures and allow certain sectors to reopen. Will construction be amongst those first sectors to reopen? You already said that it was an important engine for the economy. Yes. Of course, we can't speak of the entire construction sector, but when construction workers are able to remain 2 meters away from other workers, that is going to be the criteria used quite a bit. And we think that once we'll have gone over the peak and we'll clearly be in a descending curve, it will be one of the first domains to reopen. My question to Mr. Arruda, you said yesterday, because we're limited in the number of questions, but I asked you a question yesterday on random testing that you could do in certain sectors, for example. When do you count making these tests and in what context? Will it be, for example, in sectors, what we call the hotspots, or will it be in targeted sectors to try to have a better idea of the contamination? And when should these random testing be made? Your question is good, and it's a mixture of all that, because the objective in those kinds of screening tests, it can be different from one to another. You can have random testing within an establishment where you think that there might be an outbreak to check what percentage of people is affected. Or you can go in hotspots or territories where you want to check, let's take the example on the island of Montreal, to try to estimate the number of people who have been infected without symptoms. Are we at 30% of infected people? 40? 60? It's important because the lower we are, the more there are people who are not infected, the more there's a risk of the curve returning afterwards. And it's going to get combined not just with the test, but also with seroprevalence testing. That is, we take individuals' blood, we check their antibodies, their IgM, that is, the older or newer antibodies to see where that is. And another thing is, we think that there's going to be immunity to the coronavirus, but it's not guaranteed. So it's a mixture of these kinds of strategies. And when we no longer need tests for the other objectives as well, then we'll be able to go to those. But before even changing the entire testing strategy, and it depends whether we have 24-hour tests, tests that give you an answer within 15 minutes, that's going to be a very important element. It's going to give us very quick information. But it's really with a seroprevalence testing that we'll be able to do that. I wanted to talk to you about the decision of the Terrebonne mayor that was supported by public access to block the access of Costco's and Walmart's and to not let people who don't live in those municipalities from going into them. Are you inviting other municipalities to do the same, or do you discourage other municipalities from doing that, and so why? First, the stores that you're talking about, like Costco. What the mayor did is that he said it should only be those people who live in that municipality who should be able to go there. Why? Well, because last weekend there were a lot of people from Montreal who went to Terrebonne to that Costco. So already, we'd already said to people that there shouldn't be any moving around from a region like Montreal towards La Naudière. So it's the same thing that we were saying. So I believe that it's a good idea, especially since, there are stores in Saint-Jérôme, but there are stores in Montreal. So I don't see why it would be absolutely necessary to go to Terrebonne for those people who don't come from the Desmoulins municipality. And also, about gatherings, there are couples who don't live together, but who met, one went to the other residences, and they got tickets in the past few hours. So what is it? People who don't live together, and they are a couple, can they see one another? That's a good question. We'd have to look at what the situation is. What do they do? Now, and the question of the ticket, I don't have the context, I'd have to see. But the principle, what we're saying is, I feel like telling you, well, live together and you'll be like a couple in that sense, it'll be easier. But there's also just situations that make it that people aren't there. But if you have a person who is stuck at home and hasn't gone out at all, and both are about the same, and all they do is, leave one home to go to the other, the risk isn't high, you understand? But now the question becomes, each case becomes a specific case, and I don't want to comment on that because there is a certain judgment that is rendered. But of course, if a couple, if somebody's in a hot zone, let's say, in the middle of really hot spot of Montreal, and the other one is in Sainte-Thérèse in a zone that has very few infections. I'm saying that because that's where I live. The principle that you don't go there because hot spot. Do you understand it? That's where it becomes really difficult because it depends on the work. Does somebody work outside? There's all sorts of things to be taken into consideration. And I haven't seen the list of tickets. I did see that it was in the media, but I have to see. Because it's not so much the ticket that's interesting. It's that you have to understand that we can't expose ourselves and expose others. Yeah, and also it's important to only have the one partner, Yes, one partner. Only one partner. Oh, yes. Yes, monogamy right now is very much preferable. Well, next question. A question for Mr. Arruda. What is the value of the prognostics that will be announced later on today? Prognostic? Or you mean scenarios? Yes. Listen, I told you. We've tried, if you'll allow me. The time that was taken by our experts was to be able to have the maximum amount of information on the reality happening in Quebec right now, to be able to compare that to other situations. That will have the limits that will be exposed by those experts during scenario. The further we project, further out we project, because the curve this week is going to be decisive. And I don't want to make the presentation instead of them. I just want to tell you that the curve that we've seen, the way Quebec is behaving, is encouraging. That's the first thing. And even though they will be presenting pessimistic scenarios, as you will see, as said the Premier, the numbers that they will show you, I don't think we'll get to that unless, if we continue. Now, if everybody, after seeing the curve and everybody stops following the guidelines, well, all the work that we'll have done, we might have, to redo all over again, and we'll have taken a big step back, But what will be the most interesting, I think, is to say, as we go along in the next few weeks, week after week, to see the progression. That is what is going to be interesting. Because what interests me, I think, if the curve have helped me get reassured, is that thanks to the intense work of Quebecers, thanks to the compliance to the measures that we set up of social distancing, etc., I believe that we gave ourselves a lot of good odds. And maybe that's what the Premier wanted to say. We even have a capacity, in my opinion, we're asking ourselves the question, aren't we going to reduce the capacity, but it's too early. April is going to be a very important month. Your collaboration is super important. I know it's a long time, but we'll get there together. On a scale of 1 to 100, what would be the probabilities that the scenarios that we estimate as being the most probable will take place? Oh my goodness. What a thing. If I have the right number, I'm going to have to buy 649 lotto tickets. 75%. All right, I'll just say, put it out there. Mr. Premier, maybe? No, I was going to say that if I understood, yes, we have a pessimistic scenario and an optimistic scenario. So there is no probable scenario. I don't want to, I wouldn't want you to be disappointed. Well, what we've seen up until now, I don't know if you've understood, we are closer to the optimistic scenario than the pessimistic scenario. And I'll tell you, if I'm mistaken, I'm going to tell you it's your fault because you did not apply the necessary measures. Noted. For the tests about the inventory of reagents, are we expecting to reduce the number of tests? And is it thought, to test more regularly the employees in CHSLDs? Well, first of all, the order to test people was modified by Dr. Arruda, and yes, there is a priority for those who work in the health network. That's been planned. Now, I hope not being forced to reduce the number of tests. That is why, our procurement team is working very hard. We already know that the formula to create the reagent has been given to Winnipeg, I believe. So I hope that we'll be able to have that recipe in the next few days and that we'll be able to make the reagent ourselves. I trust this. And a point of clarification on the staff that will be transferred to CHSLDs and homes for the elderly. Do you have a proportion, the number of people that might be moved from the health network? Also, I'd like to know the guideline. What happens when a person is ill in a CHSLD? Can those people be transferred to intensive care? Are they? Yes. Yes. To your second question, absolutely. Of course, a person who is in a CHSLD and requires care, if that care can be given in a CHSLD, we do it. You know what it's like to move an elderly person. It's not ideal, especially when it's not required. So that is what we're doing right now. But if the person's state deteriorates and they need being hospitalized or intensive care, that person will be transferred. And we've had many of those cases of people who were transferred to a hospital setting in ICU. So every care is given as required. And your first question? The proportion of staff. Okay, on that I asked for a report on that. I want a daily report. So right now what I can tell you is that there are facilities that have done so already. For example, in Laval, they transferred some staff that came from hospitals and who are now in the Laval CHSLD, where, of course, they are a situation that has to be dealt with. And others have done it as well. So I want to have a daily report on that on the part of every facility. And I think that we're able to transfer a portion of people who are in the hospital sector because, in fact, we have fewer hospitalizations than we thought. But I still have to say that it's tight in certain places. For example, in Montreal, there's a lot of needs. So in Montreal, we're going to have also a closer look, and I'll get back to you. Mr. Premier, we heard you. You were happy about the fact that the number of hospitalization remains pretty low. Dr. Ruud also said that was one of the most reliable indicators, the number of hospitalizations. But in as far as there are people who are very ill in CHSLDs, is that indicator really representative? Do you count the people in CHSLDs as being hospitalized when they have COVID and are very ill? We imagine that these are people who perhaps in other circumstances would be hospitalized? Yes, you're right that we have to be prudent when we look at only hospitalizations because there are cases sometimes in CHSLDs where sometimes when it's necessary to be transferred to the hospital, it's done, but sometimes it isn't necessary and it's not done. So in fact, hospitalizations, the number is perhaps a little bit falsified because we do not include those people who are very ill in CHSLDs. If you'll allow me to add an element to that, one thing has to be understood. In CHSLDs, my wife works in a CHSLD. That means that people, depending on the state of the person, for example, will decide, do they want to transfer that person to hospital? Do they want ICU? Do they want to be intubated? And that is in the care plan, independently of the coronavirus. There are people who already told their doctors they don't want to be transferred to a hospital setting. They want to have comfort care, etc. And a good proportion, and I don't have the exact number, but there are people in that who will say it right off the bat, and the family will agree. And sometimes we ask the question again to be sure that people haven't changed their minds. For example, somebody who's in terminal phase and they are in a situation of very advanced dementia, and the family has agreed that if there was pneumonia, for example, we treat them, give them antibiotics, we give them a chance to get through it, but they won't necessarily get transferred in a hospital setting because those patients, when we transfer them to hospital setting, we have to intubate them, and then often we can't extubate them, and it becomes a lot more difficult to remove that. And that is before even the coronavirus. This is not a new measure that's been set up, to say that we don't want to treat these people. These are people that have a level of care and of intervention, that's been agreed upon. And the number that is the most reliable are the deaths, because cases, it depends, how many we tested. Hospitalization, there can be a part in CHSLDs, but it's already better than just the cases. But, the fairest, most just measure is the death toll. On the same idea, it's been 2 days that we see that the total number of cases, the increase is inferior to 10%, but is that significant in as far as there's a lot of people who say we should test everybody in CHSLDs, all employees of the health system? Visibly, we are closer to not being able to test, that there's going to be a shortage of tests. So is that, does that affect the number of cases not increasing as much? Okay, well, first of all, never in any, and of course it depends on capacity, but in no country, and in influenza, we only test a certain proportion to be able to predict. It's trends that are important. So if you have a decrease of hospitalized cases, it means that the virus, and hospitalized cases are always like 15 days after the event. So, now we had the spring break. There were community introductions in certain areas. So you have to look at the trends. And we look at the rate of positivity of our tests as well. If the trend is to the stabilization of hospitalization as well as the stabilization of ICU, that you test a lot or not so much, the serious cases remain stable in time, even the untested cases at the beginning. So, and we have curves where we see the interventions that we did, when we increased the tests. And of course, at some point, we're going to see the number of tests increase very significantly. But these are not severe cases. Do you understand? So the marker, it's as if the temperature of the water, I take it with deaths and hospitalizations, and the rest is an estimate. Thank you. We are now going to go to English questions.
From CTV News.
The CHSLD in Saint-Dorothée had a major outbreak. The union and the staff too are saying, they're angry because they say they weren't tested enough, early enough, and they don't have enough protective gear. Some family members even say they were sharing the same washrooms. What is being done to protect all the people involved?
It's a big operation. I've spoken actually to the Director General of that organization, and a lot of measures have been taken. First of all, I want to say that all the protective equipment necessary is there and should be there for the staff. So this is being done. There have been staff that has been displaced from, for instance, the hospital or other areas where there's no activity to the CHSLD. There are now nurses in prevention of infections who are working on the premises. And there are physicians, additional physicians also, who are on the premises. So there's a lot of measures that are have been taken, and the situation is being really taken care of very seriously by the organization.
Second question.
And there are a lot of companies that are changing their operation to make masks, visors, and other PPE. We're seeing communities that are making stuff like that using the 3D printing technology, and they're giving it to hospitals. How do we know if this PPE meets the quality standard? Who is checking it?
Look, we have a big team of people at the ministry who are looking at all this operation. And we are in contact with Santé Canada, and we're working also with the Ministry of the Economy and Innovation. So in this context, all this operation is being accelerated. So these enterprises have to be also validated, as you're saying, and this process is being done, but in a faster way.
Katsani, CBC News.
I would add something.
Yes, Mr. Legault.
We have a kind of a B plan and a C plan. The B plan is to have the equipment approved by Santé Canada, and the C plan, and we hope not to apply this C plan, that's where we would use some equipment that are not approved by Santé Canada. But so far, we think we'll be all right with the B plan.
Katsani.
Around 6 o'clock, Premier Kenney will present Albertans with COVID-19 projections in a televised address. And then you had Doug Ford in a press conference talking about projections. As much as you wanted Quebecers to have access to this information, Premier Legault, you want to keep your distance from these projections that will be presented. What do you want Quebecers to understand by the fact that you're not going to be there?
Okay. My responsibility in the last few days was to make sure that these experts will have all the answers that Quebecers will like to have to their questions, all right? But I'm not the one dictating the answers. I think the answers, the figures, the forecasts, they have to be done by experts, not by politicians.
I have the same question than Hugo regarding the hospitalization rate, in Quebec. Is it an accurate assessment of how many people are seriously ill, since we know that there are many elderly who are treated in CHSLD and who would otherwise be hospitalized? And you said it in French, so it's not an accurate number, 100%.
But still, to give you a few figures, at the beginning, in the last few weeks, we were forecasting that there would be 15% of the cases that would be hospitalized. Right now, we are between 9 and 10%. So it's a lot lower than expected. Yes, we don't take into consideration people that are in CHSLD, but still, if we take that into consideration, we're a lot lower than expected, and that's a good news.
Thank you. So now a few questions sent by email. The first one is from Philoté, Montreal Gazette. It's a question for Mr. Arruda. We are seeing more and more outbreaks in seniors' residence and CHSLD, such as in Laval. Is there any plan to test everyone in these residences, as it has become clear some people have the virus but are not showing symptoms?
That's part of the strategy we're going to use. It's going to be analyzed each case by case. I think the most important thing is to apply the procedures to protect the employees, the healthcare, and also make sure that we have hotspots in those places, not mixed with the light spots. But it could be an approach, depending of the rate of contamination, to test everybody, personal and also residents.
Now, second question for Mr. Autier, but ask to Mr. Legault. We are hearing many Quebec farmers say they are worried they will not be able to plant their crops because of a lack of temporary foreign workers. What is being done to help?
Okay, we're working very hard with the federal government. The Minister of Agriculture, André Lamontagne, is working to make sure that we have as many temporary workers as possible. But we're also working on the B plan, where we would give an amount to Quebecers who would like to come and work with agricultors this summer.
Now a question from Raquel Fletcher, Global News. There are outbreaks in numerous CHSLDs and private centers. How does the minister qualify the situation? Are family members being left to die?
Oh my God, no. We're doing everything we can to protect the elderlies, and I can assure the families of those people who are in the CHSLD that no efforts is let go. We are doing everything we can, and I spoke today with the Director Generals of all the organizations in Quebec, and they assure me that they're taking all the measures necessary. We're going to, for one, we're going to displace, and it's already started. They have started to displace staff that is, for instance, in the hospitals, where there are some activities that are not being held at this point because they are elective, so, and other areas that are not being active. So we are displacing those people in the CHSLD. We're putting also nurses who are prevention of infection nurses, physicians. I've spoken with the president of the Fédération des médecins omnipraticiens, and family doctors are going to help in the CHSLD. So a lot of measures are taken, and we are going to see to that situation and to protect the elderly in the long-term facilities.
Very last question from Global News. The self-care guide is being distributed door-to-door in French. What efforts are being made to make it widely available to the English-speaking community? Is it being translated into other languages?
It's already translated in English, and I will look at the possibility of a translation in other languages. So in English, it should be distributed just like the French version, and it's also on the site of the ministry, so it's accessible for everybody.
All right. Thank you very much. C'est tout le temps que nous avons aujourd'hui. Merci.
That's all the time that we had today. Thank you.